be starting the session in next 2 minutes. We are just waiting for everyone to join in, and in next 2 minutes we'll be starting the event. Okay, so let's start the event. Good evening, everyone. I would like to extend a warm welcome to all of you on the behalf of Team Dentist Channel Online. I'm Dr. Aditi Mishra, and I'll be the host for today's session on the topic Introduction to Injectable Dermal Fillers in Facial Aesthetics by none other than Dr. Arun Srinivasan. So before beginning the session, I have few housekeeping notes to make. Those who have joined us just now, they know that whatever question they have, they can put in the question and answer box in the control panel, and each and every question will be answered in the end of the session. And those who have not subscribed us on Prime membership, I request them again that kindly do it ASAP. You'll be getting e-certificates, you'll be getting a lot of added benefits of Prime membership. Visit our website www.DentistChannel.Online and read about Prime membership and do subscribe for it. Now I just request participants to let me know whoever have joined us from the previous session, because okay, and those who are new to us, let me tell you that this is the continuation to the webinar which we had last week, which was on the topic Introduction to Botulinum Toxin in Facial Aesthetics. We'll be doing introduction to injectable dermal fillers today, and it is a continuation of previous webinar. I just request participants to raise their hands so that we get an idea that how many people have come from the previous webinar. Okay. Alright, so without further ado, I welcome our today's I will again introduce our today's speaker to everyone, Dr. Arun Srinivasan. He has completed his undergrad from the reputed Sri Ramachandra Medical University, Chennai, and went on to pursue his post-graduation in endodontics and conservative dentistry from Dr. RML Awadh University, Lucknow, after which he went on to acquire standard proficiency in lasers from ALD University of California at San Francisco. I welcome Dr. Arun. Dr. Arun. Dr. Arun, can you hear me?
Yes, I guess I'm visible now.
Yeah. Yes, sir, you're visible.
Very good evening to everybody, one and all present there. I hope we have doctors attending from last Sunday session. And for them, this should be a continuation. However, I will also be, retouching some aspects which are important, which were taught in the last session, but I'll be reteaching them again as well. So hopefully, Raat ka time and not everybody should get bored. Please bear with me. Okay.
Over to you, sir.
Okay, so I'm going to start the screen sharing. Before that, I would like to tell everybody कि कोई भी any doubts that you guys have, put it on the chat. We will be addressing each and every doubt at the end. Okay. Is my screen visible, Dr. Aditi?
Yes, sir, it is visible.
Little technical glitch at my end. Yeah. So screen sharing is on. Everybody can see.
Yes, sir, it's visible.
Okay. So last time we spoke about, we made our introduction to the world of botulinum toxin, okay, or toxin or Botox in the field of facial aesthetics, right? Today we are going to be addressing some an equally interesting modality in anti-aging or reparative aging facial aesthetics, which are known as fillers. Now, we use the term dermal fillers, right? So again, that's a misnomer because fillers are not just to be placed into the dermal level. Okay. Um, though it is a term dermal fillers, I use the term fillers because they can be placed supraperiosteally or intramucosally or intradermally or in the deep subcutaneous regions. Now, before we go on further, what are fillers? Okay. Now, instead of me reading out what's there in the slide, okay, I'll just explain to you everything in a nutshell. Think about it. Imagine a gel-based implant, an injectable implant, okay, which is going to be injected onto a certain layer, in one of the layers underneath your skin. It can either be resting on the bone, or it can be just below the fat layer, or it can be in the dermis layer. Okay, what is it doing? It is actually being placed into that layer. It is going to absorb moisture. It is going to swell up, and it is going to give a nice lifted, stretched, hydrated, and rejuvenated 360-degree rejuvenated look to the face. So that is what a dermal filler does basically. Now, when we spoke about aging last time, right? You remember I used the term, I used the terms wrinkles, then static, dynamic. Okay. Now, we had already spoken about what to do with dynamic or voluntary wrinkles. Today, we are going to talk about static wrinkles. Now, let me refresh your memory. When we spoke about static wrinkles, what did we say? The more number of dynamic wrinkles that are formed over a period of time, there's going to be loss of volume or loss of fat content along the invaginations or the fault lines, which is going to give the permanent wrinkles or static wrinkles. Now, one way of approaching it is, let's stop the dynamic wrinkles from happening by using botulinum toxin, right? And prevent the aging. But what about people who already have static lines? What about people who already have that sagging? For them, dermal fillers is a very good option. Best part is the results with fillers, right? They are on the table. Instantaneously, you can see the results. Okay, so these are substances used in soft tissue augmentation to enhance the lost volume, restore or enhance the lost volume. So with fillers, what can we do? We can take care of static lines. That means fill up or revolumize the wrinkles. Then whatever part or fat has sagged down or gravitated, we can lift it and reposition it back and make it youthful, make the appearance youthful. Okay, so either we can repair or we can rejuvenate. Basically, we do 360-degree rejuvenation. We also restore the lost hydration of the skin. Okay, so what is that? It is something which is rectifying any discrepancies. It is beautifying. See, we are all already beautiful. This will beautify further. Then lifting of what is sagged and anti-aging. And definitely last but not least, and my favorite point, it is a huge money-making avenue. So fillers are awesome. That's what I say. If I want to classify broadly, I can say number one, based on longevity, it can be temporary, okay, or non-permanent. Generally, they stay up to 12 months, and then they have the advantage of spontaneously disappearing. When I say spontaneously disappearing, what I mean to say, what I tell you, it is a gel bag. It is a gel injectable implant, which is sitting in the layer of the skin. After it has run its course, it's going to deflate. It's going to lose its shape like a bean bag. Okay. So similarly, an adverse effect with such temporary fillers also, will also go off soon. Okay. So examples are described here. Then we have bovine collagen, which is animal-based collagen-based products. Brand name the Zydam 1, 2, Zyplast. Then you have human tissue-derived collagen, Cosmoplast. Then you have the synthetic fillers, which is the hyaluronic acid-based fillers, which is mostly what is used right now. Okay, collagen was used in the beginning earlier, but collagen gave a lot of iatrogenic issues, lot of discrepancies and swellings on the face, and that is why we had to move into different products. Today, the bulk of the fillers are basically hyaluronic acid based products. Okay, then we have the permanent fillers. Okay, they are they are there for much longer amount of years, but the side effects with them. Now, based on the site of placement, we have the dermal, subdermal, supraperiosteal, and based on the origin of the filler material, we have the heterografts, which are the bovine collagen, then hyaluronic acid derived, and the porcine collagen, that is permacol and fibril. Then allografts are human-derived collagen. Autografts are autologous fat transfer, autologous collagen. That means from the same fat or collagen from the same patient. And then you have synthetic materials such as bioplastic, biopolymers, silicones, and PTFE. Now, what are the different brands? There are some different brands that you can see. The big names are the Allergan company branded Juvederm. Then you have the Boletero by Merz. Then you have the Emervale and Restylane from Galderma. Then similarly, you have the Radius, Sculptra, Perfecta, Teocial, everything. Okay, so these are all some of the brands that are available in the market. So there are some Korean, Chinese cheaper brands also. So are these reliable? What is the best filler brand? So we have to classify, okay, what is the ease of injection? See, fillers are gel injectables. Okay, there's a certain extrusion force that is needed. Okay, so is it easy to inject? Hope we don't need to inject too much out. You know, what is the extrusion pressure? What is the force of it emerging out? Then is it a registered brand? Is it approved by agency like the FDA? Are you getting pre-filled syringes, or are you getting jars of the filler where you have to take it out, and risk contamination, put it in the syringe and then inject? Okay, is it pocket friendly? Then is the lifting capacity of the filler very good? How long is it? Is it durable? Tech support in case you are going somewhere wrong or you want any sort of training. So does the parent company support you there? Then experience, client experience as well as injector experience. So all brands, whatever you're using in the since I'm not promoting any brand, whatever you're using, you have to actually have a criteria which is according to this checklist here. So let's talk about signs of the hyaluronic acid fillers. No, don't look at what I've written here. Okay, this is all text. I'll explain to you in a simple form. Hyaluronic acid fillers or hyaluronic acid gel, okay, they are present. If you look at their chemistry, it is formed in, they are cross-linked polymer chains. Very simple, take a string of noodle, okay, and another string of noodle and connect it with small toothpicks. You have a ladder-like formation. That is what hyaluronic acid molecule or the filler molecule looks like. It can be a combination of a long chain and a long chain, or a long chain and a short chain, or two short chains, all connected by a cross-linking agent. This long or short or long chain, this is the hyaluronic acid chain, right? It is the polymer chain. The cross-linker which is connecting these chains, okay, why is this important? Because this imparts stability to the molecule. The better the stability or better the cross-linker, the more longevity it has under the skin. Okay, one more thing is it has fillers have a hydrophilic nature. That means they tend to absorb or they tend to have water sorption under the skin. And this gel swelling happens because of the absorption of the moisture. So once the filler absorbs the moisture, hydration happens and the lifting happens even more. Okay. So if I want to see the ideal characteristics of a filler, it should have a long duration. It should, promise some sort of performance. It should not be painless. It should have reasonable cost. It should not be toxic. It should not cause inflammatory or carcinoma. It should not migrate from the portion you have injected. Like, for example, if I have injected here, it should not go here or here. Then it should try to be of a non-animal origin. Should be easy to inject, easy to store, ease of learning how to inject, minimal side effects or downtime, and it should be biodegradable in case of the temporary and the semi-permanent fillers that we are using nowadays. So what are the indications? The wrinkles, the static lines, wrinkles, folds, enhancements, let's say lips, cheeks, chin, depressed scars, tear trough, which is the under eye, chin and jawline augmentation, reconstruction, post-surgical treatment, aesthetic treatment, then augmentation of major areas such as the bust or the gluteal or the buttock region. So small example, you can augment all these regions, be it lips, nasolabial region, then you have the marionette, which is the corner of the mouth sagging, jowling, which is the lower face sagging, zygomatic augmentation, cheek augmentation, under eye, tear trough augmentation. Apart from that, whatever static lines, let's say the forehead static lines, horizontal, vertical, crow's feet, static crow's feet, everything can be taken care with the injectable fillers. Contraindications, autoimmune disease, CVS, CNS, pregnancy, lactation, very basic contraindications, history of allergic reactions in the past to fillers, active inflammation like acne. So don't inject in an area which has an active inflammatory area. Then keloidal tendencies, unrealistic expectations. Most important part, patient comes to you thinking the fillers lagwa ke they'll start looking like Katrina Kaif. No, you have to tell them that we can give you fillers and enhance what's already there, not suddenly make you look like Deepika Padukone or Katrina Kaif. So this is very important. You have to address the patient's expectation before pitching the product. So again, I'll just come back before I go on to fillers. I'll come back to aging. Remember, I spoke to you about all these layers and how they age independently. Last time we were majorly concerned about the muscular layer, which is going to lead to fat devolumization. Okay, today we are going to talk about fats and ligaments. Okay. Now, when I remove the epidermis and the dermis of the skin, it's going to lead to the subcutaneous fat pads. Okay, the whole face is covered by subcutaneous fat pads, as I told you last time. Now, what will happen over time? Two things will happen. One, they will lose their volume. That means they will decrease in size. There's going to be shrinkage and loss of volume in the fat. Another thing that's going to happen is that there is going to be sagging along the force of gravity. There's going to be gravitation of the fat pad downwards. Okay. Now, one more important thing I want to tell you about is the presence of a layer called as the SMAS layer. SMAS. The full form of SMAS layer is superficial musculo-aponeurotic system, SMAS. It is a fibrous connective tissue network which invests in the facial muscles as well as connects them with the dermis layer. If I want to simplify what I said, it is basically a matrix which is having the muscle underneath and the fat above it. It is a matrix which is holding, it's a connective tissue matrix which is holding the fat as well as the muscle. All right. So this layer is very important when we talk about the facial anatomy, because facial anatomy is very, very important when we talk about fillers. Another important aspect in dermal fillers is the presence of retaining ligaments. Now, when we talk about maxillofacial anatomy, okay, when we talk about anatomy, we were all taught bone, we were taught nerves, artery, vein, lymphatic drainage. We talk about, but we never spoke about retaining ligaments. Now, what are these retaining ligaments? Okay, now if I tell you a small example, when we make a sandwich, what do? We take bread, we put the cheese, we put the paneer patty, then we put the lettuce and then vegetables and then another layer of bread on top. Now, if our parents want us to maintain its integrity so that it remains in one piece in the tiffin box, right? What do? We put a toothpick in a perpendicular direction, then only the layers of the sandwich are held together. Think about these ligaments which are perpendicular to the layers of the skin, as these specifically these toothpicks which are holding all the layers together. Now, with time, what happens? These ligaments act like plants. They will wilt. So, if they're perpendicular to the direction of the skin and they wilt, so what happens? What all fat component they are holding in place, right? That will also bring down. Like, for example, I am the ligament. With age, I will bend down. I will wilt. So, whatever fat I am supporting, no, the facial fat that I'm supporting, that will also go down with me, right? So this is how the facial sagging happens. So what have we learned till now? Facial aging. What are the different types of aging? What are different symptom signs of aging? We see wrinkles. Wrinkles also what we see dynamic and static. Static is due to devolumization. Now a new thing what we have learned, another sign of aging, sagging, facial sagging. And what is why is this facial sagging happening? It's because of the wilting of the retaining ligaments of the face. If the retaining ligaments will wilt, the fact that they're holding together, that will also go down along the force of gravity. Okay, so that is why the knowledge of the retaining ligaments are very important to know that what sort of aging has happened, what has happened, why is this, why is one portion sagged, why is my lower third sagged, why is my nasolabial become so sausage like. So that is what. So this diagram that I'm going to show you next is actually how the retaining ligaments work. See, we see from the leftmost, can you see? This is called as a true ligament. Okay, there are two types of ligaments, true and false ligaments. True ligaments also known as osteocutaneous, because it's taking the attachment from the bone layer, osteo, and take origin from the bone and attachment to the skin. So osteocutaneous. Can you see this ligament is actually, it is holding so much of fat here. And with gravitation and with age, what is happening? The ligament is wilting and the fat and some part is getting disintegrated and everything is going down. Everything is going down. But in the rightmost diagram, what have we done? We have used a filler to reposition the wilted ligament back into its original place, and hence whatever sagged, we have lifted and kept it back using fillers. So that is how another way that fillers help in restoring the lost youth. Okay, correction and rejuvenating youth. This is another diagram which shows aging. If you see the lowermost row, A35, all the fat pads and the volumized, it is properly volumized. But by the time the patient becomes age 55, the volume is also lost and everything is gravitated as well. Another very important anatomical aspect that we need to understand is the vasculature. Because if you do not know your anatomy, especially the vasculature, if you do not know these points, you are definitely going to cause major iatrogenic errors. Always understand, fillers are reversible, but if by chance you have injected a filler and it has come into contact with vasculature or artery, immediately the artery is going to get occluded and tissue necrosis will immediately happen. It's a very bad iatrogeny. It's the worst thing you can do to your aesthetic patient. Okay. So knowledge of anatomy, knowledge of facial vasculature is very important. One of the most important vasculatures that you need to know about is the facial artery, where it is coming from. Okay, what layer of the face at what area it is. Like for example, now the facial artery, it is a branch of the external carotid artery. This branch, what it does, when it comes into the maxillofacial region, it is lingual to the ramus of the mandible. But the first time it comes on to the buccal aspect of the ramus of the face is the anteromedial aspect of the masseter muscle. Okay. In the diagram, you can see I'm pointing here. This is where it comes first time onto the buccal aspect or the facial aspect. From here, it is at the deepest layer, then slowly comes up, gives a branch below the lower lip called the inferior labial, gives a branch above the upper lip called as the superior labial, then travels upwards towards the ala of the nose, where it gives a branch called as the lateral nasal branch of the facial artery, then continues upwards along the side of the nose, and now it is known as the angular artery, where it goes and anastomoses with the dorsal nasal artery, the supratrochlear artery, the supraorbital artery. Now, it is very important to know which level the artery is. Like, for example, in the lower third of the face, the artery is deep. That means I'll inject the filler much superficially. Whereas in the ala of the nose region, the artery is at the dermis level. So hence here, if I'm injecting, I have to go and inject deep at the level of bone. Then only I'll be away from the artery. That means, in a nutshell, if the artery is superficial, inject your filler deep. If the artery is deep, inject your filler superficially. Always be away from the vasculature. But then how will you be able to judge? By knowing your anatomy, by knowing your vasculature. So hence anatomy is king. If you don't know anatomy, go back to it, read more, then only enter into such complex injectable techniques. Now, what are the different planes where we can inject fillers? We have the more superficial planes, which is either the dermis layer, mucosal layer. Okay, so dentists know the term mucosal layer. So I'll give a very simple example. We do lip fillers. Lip is considered oral mucosa, hence mucosal. Okay, now if we are injecting just underneath the epidermis or into the dermis, that is the superficial. Then we have the deep subcutaneous, that means below the fat, or rather, if I say technically, it is below the SMAS layer. I told you previously what is the SMAS. It is a superficial musculoaponeurotic system, which is a matrix. So you have to perforate that matrix and inject there. Then we have the deepest layer, which is the supraperiosteal layer. That means injecting and placing a filler just above the bone. Then we have multiple techniques of injecting. We have the bolus, where you go to your certain spot. Then we have then we have the cross hatching, where we make the frameworks and do the multiple.
Sorry to interrupt you, sir, but there was some technical glitch in between, so we couldn't hear the last 1 minute.
Okay, just the last 1 minute. Can I repeat?
Yes, sir. Yes, sir. Sure, sir.
So I'll repeat from injection techniques again.
All right.
So there are multiple techniques of injecting. One is called as the bolus or the aliquot, where we go into a certain layer. For example, in cheek lips, we hit the zygomatic bone, and we deposit that filler in the region and make it sit on top of the zygomatic bone, giving us a lift like this. You can see how beautiful it looks when I lift both. So this is cheek lift. So that is the example of aliquot or bolus. Then we have linear threading, which is basically a linear form of injecting, either while depositing the product while going in a linear fashion, or while coming out. So that is called linear threading. Then we have fanning, which is the most atraumatic method, where we can inject and deposit our product in a triangular area like this by just one point of insertion. Then we have multiple injection technique known as a cross hatching, where we can actually create a mesh or a matrix or a framework of fillers which will actually lift. So the lower cheek lifts in the pre-parotid area fillers, here it is generally done with a cross hatching technique. So now I'd like to show you some of the cases that I have done. Now I'll just discuss this case. If you look at the cornermost top left most diagram, this lady, she's actually, if she's looking at you, you'll come across, your thought will be, she's such a grumpy looking lady, but she's actually very jolly and very jovial person. Okay, now when we did a complete facelift, look at how she's looking. She's not smiling, she's normal, but she's looking happier. She's looking as if she's going to give you good news only. She is having good thoughts in her mind. Okay, similarly, if you can see the amount of sag that we have corrected, and trust me, unlike Botox, fillers give you result. This is a single visit result. This is done on the same sitting. Okay, look at the corner sagging. The corner of the mouth, when it sags and gives you creases and folds like this, gives a very tired, angry, worn out, guselle look to you. But if we correct that, look at it, automatically she looks so much happier, less tired, refreshed. Can you see the quality of the skin? It looks much hydrated. Because if you look at the composition of a hyaluronic filler injection, what all does it have? It has that hyaluronic acid, it has local anesthetic. Okay, now local anesthetic is going to go in and keep that area numb. Hyaluronic acid, if you think about it, is naturally occurring in the skin. One of the main purposes of hyaluronic acid is to absorb moisture under the skin, swell up and give the skin a nice refreshed and hydrated texture. This is what we are doing. We are using artificially, we are injecting hyaluronic acid. So that will also absorb moisture, and that will also absorb, hydrate and moisturize the skin, gives you a fresher, younger and more rejuvenated look. All right. Look at this. This I have done in anterior chin augmentation. Can you see the two diagrams here? Okay, you can see the two diagrams here. I've done an anterior chin augmentation. And do you know how it has helped? Indirectly, you can see the double chin, right? The submental fullness that we call technically. The double chin also has camouflage because the skin has stretched, because I've actually augmented, right? In fact, in skeletal class 2 cases, this is a very good treatment of choice. If a person having a deficient mandible, chin region, mental region, you can actually induce fillers, inject fillers and bring it on. So instead of surgery, the patient can actually go for this. Chin fillers, if you use a good product, they can last easily up to 1.5 years. This is called nasolabial wrinkles, which start from the L of the nose and go down to the corner of the mouth. Can you see? And I've even treated a little bit of the corner of mouth sagging, which is known as the marionette fold. Can you see the difference? Good amount of it. Now, this is a very good case. Now, young girl, okay, hardly any fat component in the face. She was actually suffering from a lack of confidence. She's young, she's in her 20s, but because of the lack of fat component under the skin, she was, her social, her presence, she was becoming a little more sedate day by day. What I did, I just did a little bit of zygomatic augmentation, as you can see. And now she can't control her smile. Earlier, she was refusing to smile. Now she can't control her smile. So these are small things you can using fillers that you can actually give a lot of happiness to the patient. Now, this is one of my favorite cases. 70-plus-year-old lady, young lady rather, and she was willing to get multiple things done. Immediately, just look at this. I have actually used a combination of Botox and fillers for her. Botox took 5 to 7 days to appear. Can you see the beautiful eyebrow lifts? Okay. But can you see how her face is looking refreshed? Can you see the chin? She's actually having a deficient chin here. Look at the diagram below. Beautiful chin. We have augmented the chin. We have augmented the cheeks. The under eye hollowness has been taken care of. All right. So this is one of my good cases. Also, let me tell you, I got a lot of good amount of money for this case. Okay. I did just imagine you get this done. You're having such problem. Don't you feel like after you get this result, won't you feel like giving me half your salary per month? So that's the thing. So on a lighter note, this is one of the good cases that we have done. Now I want to bring the disgusting image. Best part is not from my clinic. All the previous images were copyrighted. My cases, this I've got. I'm happy that I have not caused this, touch wood, till now, and hopefully I should not cause this. This is known as necrosis, nodules, inflammatory necrosis because of improper hygiene or injecting into the inflamed area. This is your bullous inflammatory regions because of improper filler placement. Now look at this. This is the most characteristic of vascular necrosis caused by filler. Can you see these two lines, snaking lines? They are representative of the supratrochlear and the supraorbital artery. That means the filler has been placed in such a way that has occluded both the arteries, and the necrosis has occurred along the pathway of the artery. So, and this happens instantaneously, and it is Though one thing about fillers is it is reversible, but why give this, lose a patient and then try to reverse it? Or rather, what happens then? Some other practitioner comes into the picture, he or she will reverse it, and then to rejuvenate it, they will put more fillers, and then they will take your patient also. They will earn continuous multiple income from that same patient. And this is subcutaneous nodules. This is not because of an improper placement, but rather due to improper finishing of the treatment. Because whenever you inject a gel, you're supposed to mold it properly. It should not form lumps underneath the skin. So this is also a very common thing that people take for granted. Just that injection, good injection is enough. No, that is why we need to do a proper finishing also. Okay. So before I conclude, I'll just take a summary of everything. First, we'll go for what is a filler. Filler is an injectable gel which is placed at a certain required layer of skin, okay, which lifts or rejuvenates. That is, either it is revolumizing what is lost, or it is going to replace or reposition what is sagged. Okay, and the third thing it does is it can even create a newer structure like fuller lips, a better, sharper jawline, a more augmented chin or a nose or newer cheek lines. Everything can be done. Now, the fillers are available as 1 ml syringes, and each syringe will contain a percentage of hyaluronic acid gel, a cross-linking agent which provides stability, an anesthetic agent, 2% lidocaine generally, and a phosphate buffering agent to provide neutrality to the solution so that you don't have any hypersensitivity reactions under the skin. Okay, now it is deposited at multiple layers. It can be superficial, such as the dermis, intermediate, such as below the SNAS layer, or deep injection, that such as lying over the bone. There are multiple techniques of injecting, and the biggest take-home part that we have to think about is that anatomy is king. You have to know each layer, you have to know each muscle, you have to know each fat component, you have to know each retaining ligament, you have to know why everything is sagged and how you have to place it back. You have to know the vasculature so that you don't make any errors. And then you have to also know how to finish the treatment by manipulating these soft tissues. Okay, so on that note, I will be taking leave from you guys. This is the time we start answering the questions. And I'll talk a little bit about myself. I'm Dr. Arun Srinivasan. I'm an endodontist and a maxillofacial aesthetic lecturer and trainer. And I have had experience with multiple aesthetic companies, pharma MNCs, corporate dental chains. Currently, owner of Dr. Arun's Data Planet, where I'm doing dentistry as well as facial aesthetics. And I have trained more than 600 to 700 doctors, consisting of dermatologists, dentists, maxillofacial surgeons, plastic surgeons. And I am also the chief partner and faculty with Center for Facial Aesthetic Training. And thank you so much for Dr. Aditi and team Dentist Channel Online for this opportunity. This is the time I start taking questions. So Dr. Aditi, let's start the Q&A.
Yes, thank you so much, sir, for this amazing session again. So before beginning the question and answer session, I will just ask for your permission to introduce my organization to all the participants. Alright, so our organization DentistChannel.Online, Healthy Smiles with Wealthy Lives. So I request all the participants for latest updates, kindly save this number and give a WhatsApp text on this number so that you get connected with us and you receive all the latest updates about our upcoming events. So let me just quickly tell you about the upcoming events and workshops that we have, and if you skip any, you can visit our website events.dentistchannel.online. So tomorrow we have two events. One is in the morning 11:30 a.m. pathologies which are related to removable prosthetics by Dr. Manheet Singh Lel, and in the evening it is short dental implants by Dr. Himang Zala at 9 p.m. On Sunday we have three events. First is at 11 a.m. full mouth rehabilitation by Dr. Ojaswi, holistic dentistry by Dr. Dennis at 6 p.m. and at 9 p.m. we have the blood derivatives and their application in facial aesthetics by Dr. Melvin Johnson. So we have this workshop coming up, workshop for implantology for beginners batch 2. Batch 1 we had last year. So this will be on 7th and 8th of August and 14th and 15th of August 4 to 7 p.m. For all the details you can call or WhatsApp on this number, or you can visit our website events.DentistChannel.Online. And those who have not subscribed to our Prime membership, do it ASAP, and it will just cost you 499 rupees, but it will give you all the benefits. You can check on www.DentistChannel.Online, and you can follow us on Facebook, Twitter, YouTube and Instagram. Now let's quickly move to the question and answer session. Okay, so the first question which we have is from Dr. Prashant Dheya. He is asking how derma fillers help in post-traumatic residual deformity.
Yes, so let's talk about one case that I have done, I think around 4 years back. It was a mid-facial deformity, which was a result of a bullet wound. It was the patient was an army officer, and because of bullet wound, he had a unilateral mid-facial defect, post-surgical, because the filler even after surgery, the cheek, the anterior malar region could not be placed back to as equal to the opposite area. Now, in such cases, let's think about it from a surgical aspect. Whenever we have a mid-face deformity, the titanium plates are placed, so that we have a osseous reconstruction. Simple. Once the osseous reconstruction is done, once the suture and healing, everything is done, once even the overlying soft, I understand there'll be a lot of fibrous tissue under the skin, right? Correct? Logically. Now, if we do cheek lifts, anterior cheek lifts, don't you think I can revolumize what is lost like this? You can see the screen. It was like this after surgery, bullet wound. But after I can put because what is it? It's an inflatable, it is a inflatable implant gel. We are implanting a gel which is going to lift or augment the tissues anteriorly, upwardly. So here is your answer. Surgery followed by healing, followed by dermal fillers, cheek augmentation. Let's go to the next question, please.
Yes, next question we have from Dr. Akhil Menon. He is asking difference between botulinum toxin and derma fillers, which is the most preferred one.
Okay. Dr. Aditi, can you answer this after both the sessions? Chalo, I'll take it. I'll just pulling your leg. Okay. See, they are two totally different modalities. Okay. I will not trouble you, Dr. Akhil. I will not tell you should have attended the previous one. I'll give you a summary. Botulinum toxin is an agent which causes transient muscle paralysis for a period of 4 to 6 months. It works at the level of the neuromuscular junction. What does it doing? It prevents muscle contraction. If muscle contraction is prevented, dynamic wrinkles are prevented. Hence, it is a anti-aging or preventive aging modality. It is not going to reconstruct any new things on your face. It is going to prevent the wrinkles from occurring on your face. So it is a preventive or an anti-aging modality. Whereas when the static lines or the permanent wrinkles are formed, or there is sagging which has already happened, to repair it as a reconstructive or reparative module, we use dermal fillers. So there are two totally different modalities which can be used in conjunction with each other as a combination therapy as well. But they're two totally different things. Never confuse both. They both have their own separate They both have their own separate value. Nothing is better than the other. There are some cases where toxin is preferred. There are some cases where fillers are preferred, and there are some cases we don't have an option. We have to use the combination of both. तो वही बात है, अक्षय कुमार या सुनील शेट्टी दोनों हीरो हैं. ठीक है, next question.
Next question we have from Parminder Kaur. She's asking, how can we get certified for fillers and Botox?
Okay, so there are a lot of academies that are offering certifications. This is something I'll just play very politically correct here, not promoting anybody. I'll just say कि online जाइए, अच्छा certification ढूंढिए. मैं मिला तो मुझे ढूंढिए. ठीक है, indirect marketing कर ली अपनी मैंने डॉक्टर अदिति. मैं मिला तो मुझे ढूंढ लीजिए, डॉक्टर अदिति है उनको ढूंढ लीजिए. हम सब आपको हेल्प कर सकते हैं सर्टिफिकेशन के लिए.
Perfect.
जो भी अच्छा लगा वहां जाइए, कोई फोर्स नहीं.
Anyway, we'll be collaborating and we'll be announcing one online workshop with you, sir, as well. So, yes. Dr. Sai Megha Menon is asking, a dermatologist here recommended that for an eyebrow lift, we cannot inject just below the eyebrows for the lift, and only forehead Botox indirectly lifts the eyebrows. Please clarify.
I told the exact same thing in the last lecture. You remember? Upper forehead expression lines with an indirect eyebrow lift. We had already discussed that. But still, yes, I'll just, Dr. What's the name? Dr. Megha.
Dr. Sai Megha, yes, sir.
Dr. Sai Megha, see, what we are doing when it comes to eyebrows, no? We are controlling the muscle which is the only eyebrow elevator, which is the frontalis or the frontal belly of the occipitofrontalis muscle. Now, the frontalis is the only eyebrow elevator. So, if we use toxin here and relax it, okay, or relax it in such a way that the peripheral aspect of the tail of the eyebrow is in a lifted state and the centrally is more depressed. That's how we can give the, like this, we can give a beautiful indirect eyebrow lift. See, when it comes to eyebrow lift, there are a lot of direct and indirect techniques. I personally prefer, like how your dermatologist had told you, I also personally prefer the indirect eyebrow lift by treating the upper forehead. But there are other techniques also, like for example, augmenting the temporal region or augmenting the tail of the eyebrow using fillers. So there are multiple ways. If once you start learning the basics, you will get to know what are the different eyebrow lift techniques. Yes, Botox, upper forehead Botox is one of the most preferred eyebrow lift technique because it's indirect and safe and with predictable results. Okay, next question.
We have one more question from Dr. Dhaya. He's asking, any adverse reactions of skin appendages interaction with dermal fillers?
Okay, now the biggest issue with dermal filler interaction is when filler comes in contact with vasculature. I've already told it during our session today, but yes, if a filler comes and touches the vasculature, it will occlude the artery. If the artery is occluded, necrosis starts. You remember the last diagram, the two lines, snaking lines here, that means what it clearly showed beautifully that somebody attempted to take care of static lines here, right? In the glabellar complex or the frown lines which had become static. Somebody tried to do it in such a way that they ended up too deep and directly hit the supratrochlear and the supraorbital arteries. And that's why the necrosis took place. So that is the biggest disadvantage or fear factor when it comes to dermal filler injection. However, unlike Botox, filler is reversible because if we are using hyaluronic acid fillers, we have something called as the hyaluronidase, which is a protein anecdote which cuts the hyaluronic acid. So fillers are reversible, but always try to avoid the reversible part. And when it comes to skin, right, fillers do, more often than not, fillers do good on the skin only. Okay. And like for example, it will increase the hydration. It will take care of the wrinkles. It will take care of the sagged fat component. Okay. So when you talk about the skin as such or layers of the skin, it's good as long as there are no iatrogenic errors or vascular interactions. Okay.
Yeah. So we have one more question, sir. Question is from Dr. Jigunu, if I'm pronouncing it correctly.
Yeah, is there any antidote to reverse immediately? And yes, I told you hyaluronidase. I just told the answer. Hyaluronic acid and the cutting thing is hyaluronidase. Now, I'll tell you one interesting thing about hyaluronidase. Now, hyaluronic acid, what did I tell you? It is a molecule which is naturally occurring in the skin also. And hence, this natural hyaluronidase is also occurring in the skin. If there's a good, there's an evil. We know that concept. So HA molecule भी skin के अंदर है, and anti-HA protein is also under the skin. Similarly, they made artificial hyaluronic acid filler and artificial hyaluronidase also. So everything can be reversible. But always my ultimate aim is I treat every case, no matter how experienced I am, never consider yourself perfect, because anatomy is anatomy. It can cause a big surprise any day. Okay. So don't just follow instincts, follow anatomy. Follow the surface markings. If you are having doubts, go back to anatomical study. Then only do a lot of cadavers. I've done a lot of cadaver workshops. Then only I am able to sit in front of you and being able to train you today. So a lot of things, and that's all.
Okay. So we have 2 more questions, sir. Can we take up that?
Yes. I'm free only. रात का time में खाना ही खाना है. Netflix देखना बस.
All right, sir. Next question is Dr. Akhil is asking duration of derma fillers.
Okay. Now, duration, if I tell you, there are a lot of things. What causes the duration to lag? First, let's address that question. That is the cross-linker ability. I told you, long chain on another long chain or a short chain connected by cross-linkers. Now, this cross-linkers is the one which is going to provide stability to the molecule under the skin and prevent harm from the natural hyaluronidase that is present. Now, if the brand has a very cheap quality or not a very patented technology of cross linkers, that is one reason where the duration is reduced. Number one. Number two, the percentage of hyaluronic acid in a product, that also decreases the longevity. Let me give you a certain example of both things. Okay, I have, let's say, a brand called Restylane Lift. Restylane, which is a premier brand, and a Korean brand, let's say we call it Aqua Plus. Okay, both the type of products are the same. There's a deep kind of product which is a heavier product which I'm going to use for a cheek lift. Now the Restylane, the premier brand, is going to have a patented cross-linker technology with a lot of years of longitudinal case studies and everything, which has proven that एक बारी मैंने cheek lift किया, that it will stay for 1.5 years, whereas the Korean one might deflate within 7 months. That is one reason, longevity. Another reason is in the same brand, let's say Restylane itself, we have multiple type of products. One is a heavier or a robust product which I need for the lift, which will sit on the zygomatic arch and provide like a bench press. It will provide a lot of lift to the cheeks. Okay. At the same time, Restylane is giving something called Kais, which is a lip filler, which is a softer filler. Now both are from the reputed brand, but cheek lift is lasting 1.5 years. Lip filler, any good brand, acha brand, local brand, everything is not lasting more than 6 to 8 months. So the difference is the hyaluronic acid concentration, not just the brand and not just the cross-linker. So there are multiple reasons which can define longevity. I've given you a slide which was a checklist. What is my ideal filler? Right? You remember that slide? So your answer is there. At the same time, the answer lies difference in the hyaluronic acid concentration as well as difference between each brand. The composition of it. Next question.
Next question, Dr. Daya is asking, can we aspirate before injection?
Aspiration is the key to a successful injection in dermal fillers. I was going to wind up with that. Thank you, Dr. Daya, for pull it out now. It is important to aspirate for a minimum of 4 to 5 seconds for basic injections like a cheek or a nasolabial, and minimum of 8 to 9 seconds for areas such as the under eye, because aspiration is what will protect you. If you have a negative aspiration, well and good, go ahead, inject. If you have a positive aspiration, thank God that you got a positive aspiration rather than injecting the product into the artery. So aspiration is of important and key, very important. If I say anatomy is most important, aspiration is just below that. So two most important things, anatomy, aspiration. And aspiration you will only be able to know if you know the anatomy. Next question, please.
So this is the last question for the day. It is any softwares to predict pre and post comparison?
The higher brands such as Allergan and all, they have their face apps and all. Okay. So like we are in the digital age, Okay, especially all of us are dentists here, we are using a lot of DSD software, digital smile designing. Even when we do our aligner cases, we do a scan and then it predicts how. Now, when it comes to facelifts, right? Um, Companies have their apps, but they have not released it for public use. Okay, they have not released it for public usage. I still remember around 3 or 4 years back, I went to one of their product launches called as products from Allergan. Okay. And there they had that app which, they were assessing the face, but all the thing is there for public use as of now. Maybe if you are in touch with some AI people, because we are doing a lot of AI and machine learning in nowadays, maybe you can team up with people who are already doing scanning and smile design. Maybe they will be able to help you. As of now, there's nothing in the core public domain. Maybe privately somebody is developing it. And if not, if you have the idea, if you have the means, please go ahead and develop something. And मुझे भी बहुत help मिलेगा. If you want, मैं आपका investor partner बनूंगा. I'll invest in your idea.
Right. So, sir, should we wrap up or should we take 2 more questions?
I don't mind taking 2 more questions.
All right. So, Dr. Sudhir is asking, anesthesia is necessary before dermal filler injection?
Okay. Now, like in the case of botulinum toxin, what I do, I use a topical anesthetic, which is a cream which is supposed to be there on the skin for 30 minutes with an occluding tape. And after that, because it is just going to prevent that initial prick sensation when you go into the skin. Best part about fillers is more often than not, the good brands will have 2% lidocaine already incorporated into the gel syringe. So once you deposit the product, that whole area becomes comfortable. Don't worry. It feels a little heavy, but comfortable. Don't worry. Okay, regional anesthesia is not needed. Generally, we use regional anesthesia like the supratrochlear, supraorbital, or preauricular superficial temporal and all, while doing the hair transplant and scalpel procedures, not for this. Next question.
Last question is from Akshita. She's asking the price of restyling.
हम किसी ब्रांड को प्रमोट नहीं कर रहे डॉक्टर अदिति, दिस इज योर कॉल. शुड आई गो अहेड एंड आंसर दिस?
No, let's wrap the show now.
Okay. Dr. Akshita can contact me directly. We will talk money.
Yes.
So my wife, Dr. Shweta, is also here. Everybody say hi to her. She's been patiently waiting for the last 1 hour when I will stop blabbering. Okay. She's also saying, "हो गया बहुत." बोला और question. ठीक है. चलो. All right. Thank you everybody. Thank you to Team Dentist Channel.Online.
Thank you so much, sir. Before wrapping up, any note, takeaway notes?
Very frankly speaking, a lot of concept that maybe because it's almost an hour into the show, I can talk a lot. When it comes to Botox and fillers, ना मुझे 5 दिन दे दो, 10 दिन दे दो, continuously बात करते रहूँगा. इतनी सारी चीजें, छोटी चीज बताऊँ, like for example, topical anesthesia, aspiration. I by mistake missed it out. It's not as if I didn't want to incorporate, but इतना सब information I've been continuously without stopping, because I generally when I present, I don't use PPTs. पूरा extempore होता है. तो इतनी सारी चीजें, I just tell everybody कि learning curve है, बहुत कुछ है. केवल लोग कुछ, अभी भी आज शाम को एक डॉक्टर मेरे पास आए थे पूछने के लिए कैसे करना है, क्यों करना है. तो केवल एक वर्कशॉप या एक फलाना फेलोशिप के चक्कर में आप अपने आप को एस्थेटिक प्रैक्टिशनर मत समझिए. डोंट थिंक लाइक दैट. You have to undergo multiple trainings. You have to give a lot of time. Tell me one thing: if you want to do a root canal, can you do it after a 4-day course? If I want to do an implant, can I learn it in 6 days?
No, absolutely.
नहीं ना. Simple restoration class on cavity, can you learn it? More, right?
No.
How to give a proper biomimetic. Even for that matter, amalgam. They slogged so much. They made us do so much cubes. एक part of procedure है ना, protocol है. वैसी aesthetic जैसे magic कुछ नहीं है. You have to undergo a lot of training programs. You have to go from here and there. You have to do a lot of patients at your own personal thing. Sometimes you even have to invest and inject into your own driver, doodh walas, maid and all. Then only your hands will get perfect. Then only you start doing patient. मैं तो ऐसे बोलूंगा, आप चलो ठीक है, आपको किसी अकेडमी को पैसा मत देना, मत दो, कम से कम प्रोडक्ट पे खर्च करके घर पे ट्राई करो, क्योंकि आपका मेड शायद आपका गला ना पकड़े. ठीक है. तो ऑन दैट नोट, थैंक यू सो मच. I'll say good night here, and hopefully I'll see you guys in something, whatever Dr. Aditi is planning for me.
Yes, yes, absolutely. Very soon we'll be collaborating with you, sir. Thank you so much for the keynote. Thank you so much for the session, and thank you so much to all the participants. Have a great day. Thank you for being a lovely audience. Thank you so much.